Hi, my name is Dushi. I'm a CQ third year sonography student. This video is created to explain about ISBAR as a part of our group assignment in vascular sonography. What is ISBAR? ISBAR is a safe communication tool widely used in healthcare settings, which help simplify, effective, and anticipated communication between the sonographer and the radiologist. ISBAR is an acronym for Identify, Situation, Background, Assessment, and Recommendation. The following slides and the role play in the video will elaborate ISBAR in detail. First step of the ISBAR is Identify, where the communication between the patients and the sonographer starts. The sonographer gets all the identification details such as name, date of birth, gender, and relevant patient's history. This is generally the first piece of information given to the radiologist when transferring the information. Then, identify patient's information will be transferred to the radiologist.
Camilla, please take a seat.
Thank you.
Before we start the scan, may I know your full name, please?
Camilla Augustine.
Can you spell it for me?
CAMILLAAUGUSTIN.
Great. May I know your date of birth?
18th of March 1935.
How old are you?
84.
Okay. May I know your address?
108 Hutchinson Drive, Lincoln.
Okay. So I'm Sasan Gaurikanthan. I'm a student sonographer from CQUniversity. I'm going to conduct a scan on you today under the clinical supervision of Mrs. Afroz. Is it okay for you?
Yes.
Doctor, my last patient has driven in from Lynbrook. And can I please discuss my findings on a 84-year-old female patient?
The situation must be explained by the sonographer to radiologist. The sonographer must include where the request comes from, which part of the body is scanned, and why it's been requested.
Experiencing this abdominal pain and sort of pulsation around her belly button. So I just completed an abdomen scan on her today.
All the background information is provided by the patients must be passed on to the radiologist, such as relevant past examination results, laboratory results, medical history, family history, most recent vital sign, or recent clinical findings.
This patient has a 10-year history of cholesterol and high blood pressure and had been a drinker and smoker for more than 20 years.
The next step is assessment, where sonographers share all the ultrasound finding of the examination to the radiologist.
Scan results and findings regarding her abdominal pain. Evidence of focal dilatation in the abdominal aorta with an enlargement of 3 centimeter. There's also evidence of a minimal plaque in her abdominal aorta, but of concern was the increased thickness of plaque at the bifurcation extending into the iliac arteries.
Finally, the recommendation is based on the sonographer's professional diagnosis, where the sonographer also include all the differential diagnosis and the reasons for their diagnosis as well. With all these vital information given to the radiologist by using ISBAR communication tool, the radiologist can now make an accurate diagnosis and send off a report to referring doctor with a clinical recommendation.
Still at the waiting room, what do you recommend as the next step, please?
I am convinced with your images that show the focal dilation measured 3 cm in anterior-posterior diameter of the abdominal aorta. It's looked like a fusiform aneurysm involved in all 3 layers of the aorta, which is infrarenal and extend to the bifurcation. The plug is also clearly seen at the iliac artery in the images. The clinical symptoms you have mentioned are typical for AAA. In addition, the patient's history such as long-time smoking also favor of confirming AAA. Now I like to speak to the patients and inform the findings, and I'll make a final report and send it to the referring doctor immediately. Okay, thank you.